Hey everybody, John Schumacher here with NewWaveHealthcare.com, and just want to give you guys a quick reminder, this is a video podcast. So if you're listening to this on iTunes or Stitcher, go over to NewWaveHealthcare.com, check out our video replays of all of our interviews that we've had. We have almost 30 interviews up there now on all kinds of different healthcare entrepreneurial topics, whether it's marketing, healthcare innovation. Come and listen and see the stories as they unfold from all of the great entrepreneurs that we've had a chance to interview here on NewWaveHealthcare.com. Also, subscribe to our newsletter. We put out a Friday curated list of all the cool articles that we've read during the week, and also the replay of the interview that we've had that week. So subscribe to our newsletter and check us out over at NewWaveHealthcare.com. All right, let's get started on the interview today. My guest is Bruno Rocca, who is the founder of HelpMeWell, which is a remote care monitoring platform that's helping bring patients and physicians together to share important healthcare information, whether that's x-rays, vitals, patient education information. It's a really secure, wonderful way to kind of connect the loops, if you will, in our healthcare system, which is often quite fragmented when it comes to sharing data between patients and medical providers. So Bruno's been kind enough to come on today to talk a little bit about his company, the story behind it, and so I hope you all get a lot of value out of hearing his story and how he created this company. So, Bruno, thank you so much for coming on today. Let's just have you start off, just tell us a little bit about you personally, and then we'll jump into your business.
Hi, John. How are you? My name is Bruno. Our company is HelpMeWell, and I actually have been sort of a serial entrepreneur for have a couple of startups that have done pretty well from a standing start to over 100 employees. And you know, in one of those situations, I actually was working in the diabetic and patient education space, and found that we were in a public health setting, and with one of the largest hospitals in the United States. And we found really that the biggest problem is that patients really want their doctors and their care teams to care about them. That's their number one complaint. So we've been building the last 2 years to in this, and we're now basically just coming out of stealth mode here in the last weeks in May.
Perfect. So yeah, I mean, imagine that, right? Patients want to have better connections with their doctors. Wow, huh? There's so much of that that's needed in our system. So your company is HelpMeWell. And so can you tell us in one or two statements, hit us with your elevator pitch, what exactly does HelpMeWell do?
Well, for patients, HelpMeWell is a system that lets them really easily and simply capture the information that their doctors need to give them better medicine. And from a provider standpoint, it's a way of providers of engaging patients between the hospital, between their doctor visits, between after hospitalizations, so in a way to actually, have an engagement with them between the office visits and capture information that lets them, provide better medicine to the patients.
So basically, you're saying it puts together the two. Patients can share their health information on a secure platform. Physicians can sign up for that platform. They can interact with the patient data that's on that platform to connect the dots and provide better care. Is that a fair assessment?
Yes, it is. That's exactly right.
Perfect. So talk about some of the key problems that we touched on a little bit about our fragmented healthcare system, but touch on some of the key problems that HelpMeWell is addressing.
Well, the HelpMeWell addresses the two basic problems. One, patient engagement is the hardest thing. That's it's an unsolved problem in healthcare, and it's one of those things where when we're working in the physical world, we were quite successful in creating patient engagement in underserved populations and regular populations by providing basically a mechanism where the population can help itself in sort of auto-form small groups, and in that process sort of enable each other. It's not the big problems, it's the small sort of solutions. It's sort of how to take your blood sugar in this way and how to sort of overcome some of the fears. And really the big problem is, it's patient engagement. And we found everybody knows that if a doctor says, please do this, a patient is much more likely to do so. But the problem is doctors don't have very much time to do that. They're only paid for 8 or 10 or 12 minutes of time. And really a lot of that time is spent kind of dealing with the absolute must-haves. And everybody knows that you really don't have that time to actually spend with a doctor. So we've basically found a way of actually sort of automating the capture of information, providing the doctor with information in advance. That's one problem. The other is that doctors, again, from the doctor perspective, they need to engage patients like customers. And there really isn't a mechanism to do that right now. You have the EMR, which is kind of a barrier between patient and provider, and you have sort of the practice management sort of email campaigns. But there's no sort of interactive way of actually getting feedback and basically sort of mechanizing the feedback loop so that the doctor can provide better medicine. So those are the two basic problems that we've sort of solved: is patient engagement and actually doctor desire to engage the patients.
Right. So are you guys providing sort of like a social media type platform where it's secure, obviously HIPAA secure, but that doctors can actually talk to patients directly, like a Facebook scenario, or is that how it works?
Pardon me. Yes, there's two things that we enable. One is patient-to-patient communication that basically sort of lets patients tell other patients how different things work for them, and sort of where patients learn about how to do that. And also, we also provide the content that doctors recommend different content for the patients. And the goal is to have sort of the content, the patient education content, to the cream rises to the top, and essentially you have doctor recommended, patient liked content rising to the top, basically for a very specific illness. So that's sort of patient to patient. So separately, there's a Facebook type of thing, which is a secure scenario that allows the patient to capture all different types of information, whether it's taking pictures of different things, whether it's capturing weights and vitals and things like that via biometrics, and then having a secure mechanism where the doctor and the patient, or oftentimes the doctor's staff and the patient, actually communicate back and forth, so that the patient is corresponded with, and there's a conversation occurring in a HIPAA secure way, but it's also a way of essentially engaging the patient in a way that the doctor actually can see which patients are engaged, and then they can focus their efforts on where the patient is lacking. Maybe they're not doing a good job of of taking their meds, but they're doing a great job of managing their fluid intakes. So it gives them an advance notice. Many doctors actually see on the chart, literally, that we have an output that goes onto the chart that just says, okay, this patient needs X, Y, and Z, and they know where to focus.
So are you seeing a lot of doctors getting on board with this kind of a solution? I mean, I know doctors, are they reimbursed for this kind of interaction, or are they having to do this as an ancillary task of theirs? I mean, what does that look like for the doctor?
For the doctor, there's a low cost. Of course, it's free for the patient. For the doctor, there's a low cost, but it's a low, $20 to $100 per month, depending upon the size of the practice cost. But for managing all their patients, so it's kind of a small sort of cost, and doctors are signing up because it actually helps. Really, it makes their workflow much more efficient, and they now have a mechanism where actually the staff actually interacts with the patients. So yeah, we're seeing lots of doctors sign up for it, and the actual reimbursement process of actually managing the patients isn't currently reimbursed for it, but our model essentially is oftentimes the ACO or the pay organization sees a huge cost savings. I mean, for CHF, an example, there's a significant reduction in rehospitalizations, which means basically a reduction in fees, penalties with the Affordable Care Act. Plus, obviously, each hospitalization is very expensive, and so we're able to reduce the number of hospitalizations dramatically.
So there's indirect savings for the organizations, as far as, like you mentioned, there's a lot of fees and penalties associated with readmission rates that are becoming a big issue for hospitals and medical facilities. So they can indirectly keep tabs on their clientele, you could say, their customers now, their healthcare customers, a little more directly by using your platform. So
yeah, that's right. And on top of that, they're able to actually manage the risk. So you can imagine a doctor or a patient, a disease management team, sort of information comes in from our system in a real-time way. So every morning there's the risks change depending upon what the weight gains or what the different sort of vitals have been captured. And essentially home health nurses or home health outreach telephone calls can be prioritized to those in need the most, essentially, where the information didn't exist before and in the hands of the medical provider. Now it does. And so literally they can sort of apply the resources that are expensive to those cases who are most at risk.
Right. Are you seeing other startups in this space tackling or looking at creating something kind of like what you're doing with this interactive social network, I guess you could say? Are there others out there, or is your company one of the only ones doing this? Can you talk about the market?
Sure. The market. I mean, obviously, healthcare is the largest. The largest market there is these days, and we're not the only ones trying to improve the engagement process. There's a bunch of other companies, in different aspects of this. We're one of the few that actually has tied in the different sort of disparate pieces that we think, in an actual physical clinical setting, really are combined together. So we combine patient education with the capturing the vitals, with the communication system with the doctors, and so that three-pointed thing really actually seems that we're one of the few that have actually implemented something like that. Most people have started out with one thing, and what we found in the physical world is that it doesn't work, right? So you actually have to have three different things or more to work. We based our sort of the behavior change stuff on the sort of world leaders in behavior change theory, and we've added on top of that sort of the mobility piece that captures information on a by minute or by hourly basis instead of sort of HRAs that are done once every 30 days.
Right. Okay, so I mean, boiling that down, your guys' company provides the solutions that it's a data storage, secure data storage area, and it's also an interaction and communication tool. Is that kind of, when you boil things down, the key solutions and issues you guys are looking to address?
Yes, okay. It is, and we try to make it simple. So, like, even the big problem is that people with CHF or COPD or even sort of the more comorbidities of diabetes, basically most of them don't have smartphones. So as a result, there's a whole group of people who can't avail themselves with all the modern technologies. We support sort of the texting of information in a secure way, and even telephonic ways, so that everybody all the patients in a group can sort of be managed with the same kind of system, and that way the doctors are sure that when they put a system in place that it kind of goes to all the patients, independent of what their technology sophistication is.
Perfect. Yeah. So they can text, they can call, they can do whatever. It doesn't matter. You have a smartphone, a dumb phone. It all works with your service, which I think is a big plus that probably other services aren't thinking about doing. So that's kudos to you guys.
Thanks.
So what inspired you to create this, Bruno? I mean, were you personally affected by a loved one or something? Did you see the business opportunity? What inspired you to create this company?
Well, I had built a natural food, one of the leaders in sort of diabetic and sort of health food products, and I'd sold it. And I went back went into the Cook County system and to try to help in patient education. And not knowing any better, kind of created the diabetes and heart health programs that were first piloted there, and then became sort of national behavior change examples. And part of that process is that we found that it was, we had dramatic success in really very underserved populations to go mainly in diabetes, but and also in heart disease. And it suddenly became, with the advent of mobile basically becoming ubiquitous, and essentially with the advent of SMS or texting, essentially unlimited plans coming about, we found that actually we can the technologies now to actually implement a system that really can help doctors, because we found that really, if the doctor's involved in the process and is pushing the process, then patients change. Otherwise, it's really hard to do it on your own. And that was the impetus. We saw great change, and really the people there. I mean, we saved lots of lives in the simplest possible way with the even we found a way to get people to just track their weight, and as a result they saved all the public health clinics saved people lots of lives as a result. So it's kind of silly but a little tiny thing like a weight gain of 5 pounds is a life or death potential thing in congestive heart failure. So that's knowing about that information when they're at home and sort of activating the healthcare team to support them is that's why we're doing it.
Yeah. Yeah, it is a severe thing in CHF. You really have to watch that weight, and I see that all the time when I'm out in practice, is that people are not monitoring their weight properly, and that's just a big risk for them. They need to really have that information readily given to a medical professional. So I think that's key. So basically, you saw the opportunity, right? You saw this technology scale was growing. These plans were now unlimited, and you just kind of had this aha moment where you were like, "Wow, we're now at the stage where we can create something like this. The technology is ready for it." And did you have like an aha moment where you thought of it? Were you out on the lawn chair or something having a Mai Tai and you came up with this, or how did that happen?
Well, I saw sort of the sort of the Cook County system and sort of the free clinic system in Chicago was amazing, and some of the people who sort of created that, and I saw actually some real success stories. And then when the Affordable Care Act came into place, I was really energized because I thought that now there would be a chance to actually change things for the good. And one of the core things was preventative health in underserved populations. It's all about wellness. And I read the Affordable Care Act as it was passed and realized that the wellness incentives there were would actually, if they done in their spirit, could really dramatically affect things. So that was sort of the aha moment, is actually going into the details and seeing what I could actually do and applying some of the stuff. And plus, I've been a software entrepreneur for a bunch of years, so I kind of knew that we kind of knew how to build it, and we started building it. I needed a good kick in the ass, though, pardon my French, and at Tech Raising 2 years ago in Santa Cruz here, we started the process, and we've gone through a couple of incubator programs and things like that in the Valley. So anyway.
Perfect. Yeah, opportunity brings about. Like you say, you were digging for it and you found it. So, what stage is your guys' company at? Are you guys in beta still, or where are you at?
We've been developing with clients, essentially employer clients. Provider clients, as well as a couple of ACOs. We have revenue. We have both the congestive heart failure, the prediabetes, and the quantified self products that are now coming out of beta. We have a bunch of providers who are signing up each day, which is good, and we now have the provider onboarding process. And we're supporting lots of quantified self people who are logging in and putting in their information and sharing it with their providers.
All right, it's happening. Sounds good.
Yeah.
So share with us a story, Bruno. And people tend to learn well through illustration. So, if you could pick one story as an example of how your product or your service helped somebody in a positive way with their health care. Can you talk about one key story that our listeners can take away from to really give them an image in their head about how your service can help them?
Sure. Actually, it's the patient's name is Sophia, and she has diabetes and a couple other comorbidities. And she had gotten a Fitbit a while ago and tried to share it with the doctor, and the doctor basically went, no, please, don't worry about HIPAA stuff. And then there was another. She got a scale and a few other things, and pretty soon she had a couple different devices. and she couldn't, so, and fortunately the doctor was one of the first ones who signed up, and she says, what, I have a patient who absolutely would need this and wants this. And we've realized and so, now the information is being tracked all the time. Her blood sugars are much more well managed as a result of this, and but she doesn't actually have one of those, sort of, she basically doesn't carry her cell phone all the time, okay? And so it's a way of she actually logs in through other ways and puts information in, and over time she's given her doctor a much better way of actually showing what's going on, and he's able to help her. So that's her. She's a happy customer, and he's actually now pushing it to his clients as well, other than her, because he sees that it really works.
Yeah, perfect. So people can use remote monitoring devices. They work with your platform, texting, calling, internet, pretty much any way you can do it, except maybe smoke signals, right? You guys don't. You guys don't.
That's the thing is, we built it in so actually even people who actually keep their food logs on a daily basis, with a pen and paper, they just shoot a copy. They just take a picture with their phone of that food log, and the doctor can look at it. And so they don't need to actually spend all this time like entering data, figuring out which UPC code there is. It's a simple, our goal is to make it literally a couple of clicks once a day, and you're able to capture your stuff. And if you're able to do that, then the barriers are less. So yeah.
Very, very dynamic platform. That's wonderful. So how are you guys, from a business standpoint, how are you guys monetizing this project?
So for patients, it's free. For providers, there's a sort of a management system between $20 to $100 a month, depending upon the size of your practice, and so which isn't affordable for most doctors. No one's actually said that it's out of the ballpark, and then for the provider organizations, there's a sort of a cost per diagnosed patient. So the patients who are well or who are just at risk, there's no cost other than the doctor fee. But patients who have CHF or diabetes or things like that, there's a population management, sort of a disease management thing that basically is a cost reduction sharing. So basically, if we save an organization a certain dollar amount, then we split in that. And so there's we guarantee a positive ROI for the payer or the ACO, so that whether it's a 2 or 3 to 1, or some people are looking at it like a 4 to 1 payback. So that's how that's kind of we're doing that.
So it's a monthly recurring per patient. Is that what it is?
It's a yearly recurring for the ACO. It's a monthly recurring for the doctor to manage their patients.
Okay.
And the doctor can take literally they upload all their patients, and there's a system of managing them so that they can sort of have all the sort of benefits of all of the email, HTML5 email marketing type of stuff that's available to them, kind of like Marketo for doctors.
All right. Cool. So how are you guys scaling this and growing this? I mean, what's your growth strategy, and how are you marketing this service?
We've just come out. We basically have a whole bunch of employers who have agreed to sign up to the product, and we're scaling those guys in the month of May and June. We're currently on a pilot with one ACO, and we're growing that to have a couple of paid pilots coming up in the summer. And we're basically building it, doctor by doctor. We have a patient, we have several primary care people on the team who are essentially, primary care advocates who, are helping the doctors sort of onboard and learn how to use the platform, and standard ways of building providers, one provider at a time. But obviously, that's we're trying to be smart about that.
Right. So, I mean, as far as metrics to measure your growth, I'm sure you're looking at how many people or providers are coming on and patients are coming on, and you said you had revenue. Are there any other metrics you guys are using to say, yes, we're succeeding, or
Well,
how is that going?
we sort of have patient engagement metrics, and one of our goals is sort of lowering the barrier, right? So we have a system, sort of we call it the Get It Now system, where a patient can sign up in the hospital before they get discharged for CHF, as an example, in literally in a couple of seconds. The nurse or the discharge person just puts their phone number in. Immediately, there's an account that's set up, and they can start logging even in the hospital before they're discharged, as an example. So that's so basically how fast people can do it is one of the critical things for us. Is if you're a 70-year-old, can you, how long does it take you on your dumb phone to text your weight? For us, it's like pound 146, and that would be a person who's weighed 146 pounds. So and then we continue to track that. So our goal is to reduce the barriers wherever we can for people who are sort of challenged, and then obviously we use the quantified self. We support now about 70 plus devices. So if you're enabled to have, a Fitbit or a Jawbone or a Basis or any one of those other types of things, or if you have the Moves app or any of those other apps that are on the devices or phones, that just automates the process, so you don't have to think about it, and that information is being captured. So.
Perfect. Yeah. So what was some of the biggest challenges that you faced building this? You said you've been at it for 2 years. Is that
2 years? Yeah. So.
What are some of the biggest road bumps? And if someone else is an entrepreneur in the health startup industry wants to learn from you and what the process you went through, what would you give them? I mean, what were some of the biggest challenges along the way?
I think that for the challenge is always sort of building team. Unfortunately, I sort of already had some doctors and population experts who are part of that, but really it's sort of building the right team, and that's always a hard problem for any entrepreneur to do. And we now have a team of 6, and that's probably been the hardest process. The other is sort of figuring out that once we built the patient side of things, that we had to build the provider side, and that's the other, is to build sort of 2 things that are interconnected simultaneously. It's sort of the chicken and the egg scenario, is that you have to be, and that's really, how do you manage that? How do you build things for 2 different personas? And when I say 2, it's actually the provider staff. We support caregivers, and that's a process. So, how do we, if you have CHF and you get home, you're disoriented, basically your caregiver, your spouse, has to be empowered to help you. How do you do? So we had to sort of build for a bunch of different personas, and that's the problem with healthcare, is it's not like one Dropbox app. It's, you have all these different people with all these different roles, with all these different rights, and that's really the hardest thing for us. It was it's tough.
Yeah, it's probably critical to be able to talk to a lot of providers and a lot of patients and get a lot of good feedback while you were building this. I'm sure that was a challenge to appease both sides, because your platform really does provide that place where a patient can put their stuff and a physician can come get it and collaborate. So they both have their own needs, and the different types of providers and the different types of patients, and healthcare is crazy diverse.
And the different illnesses. You have, if I'm talking about CHF, and it's a different thing than if I'm talking about COPD, but sometimes they're in the same, they're comorbidities. So as a result, you got to be able to do it for all 3 scenarios. So
yeah, usually a lot of people have all of them, I'll tell you.
Yeah, so. Exactly. Yeah, so it's but not everybody. So you have to well, so what if you don't have it? Then So it's a kind of, we try to sort of for patients just like the person, to try to get those small tips. And anyway, so yeah.
What's a piece of advice you could give us on building a team? You mentioned that as a big struggle for you. You said you had some people in place before this venture, so that always helps to have a solid network before you start something. But could you give us one piece of advice that you feel would be important for a startup company who's looking to build that team correctly?
I think the biggest thing is start building. Start building and getting customers to look at it. So sort of customer-driven development.
Mm-hmm.
Even if it's not perfect, you can really get, you can get phenomenal advice from people who have, in healthcare, most of the people, we're in this business because we care. Everybody in the entire giant ecosystem, has a higher purpose than just sort of going out and making money. And so so people give good advice, and they don't mind giving advice. So that's one of the things, is that get as much advice as you can from people who would be your customers, and start building it as soon as you can. So don't fall in the trap of, I can't build it. And so once you get it, so you can describe it, then you can find other people who are amazing programmers and can do that. And and pretty soon, it took longer than I expected. Certainly I thought it would be between a year and a half, and now it's sort of hitting 2 years. But we also have a much more robust product too.
Right. Right. And I hear a lot of entrepreneurs in any industry, but also in the healthcare industry, talk a lot about building something in pieces and validating the steps along the way, not to just rush out there with your whole pie on the table. Build something, get feedback, and then grow it from there. Don't just go out there and slam the whole thing on the table and force it down the consumer's throat when you don't know that they really even want it. Would you say that that's something you've had to watch out for, or you would recommend?
Yeah, I mean, I think that the lean canvas approach,
Right.
was something we use, and sort of iterating all of your assumptions, sitting them down, and what to actually do each of the different parties. We've actually built the sort of persona-facing pieces, and sort of dispelling different. Learn as you go, and learn as fast as you can, and then get it. And plus, you have to have a team that actually can. Wants to have that. I mean, it's a lot of hard work. I mean, we spent, I don't know, in the last 6 months, probably 18 hours a day for 6 people for, I think I don't know, it's 1,500, 2,000 GitHub commits. I mean, a lot of stuff. But the thing is that each time you do it, and then, I mean, I think that's learning the process of, not the lean approach necessarily, but basically finding a hypothesis, disproving it, trying to kill it as fast as possible, and then plus I think also the other thing is find a bunch of other community who are founders who have the same problems you do. I mean, I'm a member of a couple of communities, and that's probably where my best learning has come from. Because the world has totally changed in the last couple of years. So it's totally data driven, and everything we do is A/B tested. Everything we do is driven on a data driven way, and learning how to do that with people who are doing it when you're doing it is critical.
Right. Yeah. Testing. So, all right, Bruno. Well, thank you for coming on. This before I hit you with the last question here, I just want to thank you for coming on the show and sharing a bit about your company and some of the processes and some advice that you've given us around how to start a company. So here's the last question. It's a little bit of a doozy. I'll give you a moment to think about it. But if you woke up tomorrow and the Affordable Care Act had added new legislation that benefited your company, how would you want it to read?
I think that it would help. Let me think about it for a second. I think I'd want employers, small to medium-sized employers, that kind of drive the business and drive the growth in this country. I'd like to see it with the wellness programs and the sort of the cost savings in disease management kind of flow through to them in an easier way, so that there's really the ROI is there, because patients want to stay healthy, right? And employers want to save money, but where that's actually sort of those two things are tied together a little more closely. But that's I think supporting employers and it would be in that small to medium sized area would be where I'd love to see more legislation and so.
Perfect. Yeah. So. All right, well, as we wrap things up, just go ahead and tell our viewers and our listeners where they can find out more about you and your services, and then we'll say goodbye.
Okay, great. You can find our information at helpmewell.com, and for those with chronic disease, you can check out chf.helpmewell.com for the CHF portion of things. And always you can call us. We love to have phone calls. It's on our site, and as well as a fast email to either support or success at helpmewell.com. Gets a response within 4 hours. So we like to respond to our clients and customers, and we're trying to build. So
perfect.
We like input.
All right, sounds good, Bruno. Thanks so much. So, guys, I hope you enjoyed that discussion today with Bruno on his company. There's a lot of neat things happening, and connecting the patient and the doctor certainly is one of them. If you guys are watching, or rather listening to this on iTunes or Stitcher, go over to newwavehealthcare.com/helpmewell, and you'll get the recorded video conversation as well as all of Bruno's contact information and all the links mentioned during this interview today. If you are watching this on the newwavehealthcare.com website, go ahead and click on the Hear Us on iTunes tab, Hear Us on Stitcher tab. Go ahead and subscribe to our podcast, give us an honest rating so you can hear these wonderful interviews on the go. And just one announcement, we're going to be scaling out New Wave a lot starting in June. We're going to be adding 2 new shows, possibly 3 shows to the website. So we're going to really be kicking up the amount of content that is coming out. Our focus is still going to be on healthcare innovation in a lot of ways, but we're also going to be adding a lot on healthcare entrepreneurship, like marketing and media solutions for everybody who's either a health practitioner or a healthcare startup. So keep an eye out for our new launch in June. And I think that's it for now. I will see you guys on the next one.